It's been 7 days since you took the GLP-1 leap, but your waistline hasn't lost an inch. When you look at your phone, just about every celebrity you see seems to have lost 20 pounds over the weekend. Did you get a dud? Nope. These medications don't just melt fat on contact. They're quietly rebooting how your body processes food. And right now, your metabolic engine is just warming up. If you're using a GLP-1 like Ozempic, Wegovy, or Mounjaro, I'll show you exactly what happens to your body at months 1, 3, and 6, so you can determine if you're on the right track. We're throwing out the Hollywood hype. I'm Dr. Hanz, and I help busy professionals over 35 build health systems to maintain energy and focus as you navigate the corporate ladder, pull night shifts, or run a household. Let's break it down. Month 1, the "is this thing on" phase. Let's rewind to day 1. You've got your pen, you're nervous, and you're absolutely excited. But regularly stepping on the scale during these first 4 weeks is the quickest way to ruin your peace of mind. This is not the weight loss phase. This is the primer. Your body is experiencing a completely new chemical signal. Some folks have a hyper response and feel full after 2 bites. But like most of us, you might feel absolutely nothing and maybe lose a mere 5 pounds. I want you to hear this. That is a clinical success. These initial lower doses aren't designed to melt fat. They are designed to test your gastrointestinal tolerance, basically seeing how your stomach handles food moving at a much slower pace. If we rush this, you don't get faster weight loss, you just get violently ill. So if you feel left behind in month 1, relax. Your engine is just warming up. Month 3, the danger zone. Fast forward to 90 days. The initial mild side effects have usually faded and your body has accepted the new normal. For a lot of folks, this is where the magic happens. You might be down 10 or 20 pounds and your clothes fit differently. It's a time to celebrate, but it's also a time to look closely because month 3 is where people hit a wall. Our bodies are incredibly smart. They crave balance and they'll start adapting to the medication. This is the exact moment you have to stop relying solely on the pen and start relying on your routines. If you just eat smaller amounts of the same food that got you in trouble in the first place, you're going to stall out. Clinical studies show that up to 30 to 40% of the weight you lose on GLP-1s can actually be lean muscle mass if you aren't careful. So in month 3, you have to ask yourself, am I hitting my protein targets? Am I incorporating strength training? The drug is pulling the weight off, but you have to tell your body to keep the muscle and burn the fat, because preserving that muscle is exactly what sustains your physical energy through those long work days. Month 6, the pivot. Taking the medication is like brushing your teeth now. It's just a part of your weekly routine, but suddenly there's a new challenge. Food noise, that constant mental chatter about your next meal that disappeared months ago, it starts creeping back in. Your appetite isn't completely wiped out anymore. A lot of patients panic right here. They think the medication has stopped working. It hasn't. Your neurochemistry has simply found a new sustainable baseline. This is a critical pivot point, especially for the folks I work with most. If you're over the age of 35 and often feel snowed under, listen closely. You spend all day making high-stakes decisions. Your schedule is chaotic and your cortisol is always through the roof. If your only health strategy is hoping this shot makes you forget to eat, your next high-stress event is going to break that strategy into pieces. Month 6 isn't about appetite suppression. It's about leveraging the metabolic reset you've achieved to build the foundation for the rest of your life and career. You're gaining your physical edge and mental clarity back. Now is the perfect time to establish a strategy to maintain it. The GLP-1 medication opens the door, but your daily systems dictate whether you get to stay in the room. You don't need another generic punishing diet plan. You need a strategy that actually survives a long workday, family commitments, and the realities of a busy life. Helping you build those sustainable health systems is exactly what this channel is all about. We're focused on maintaining your edge, weaving together steady energy, sharper focus, and strong metabolic health without turning your life upside down. If you're ready to build a realistic routine that actually works for you, hit subscribe so you don't miss a thing. I'm Dr. Hanz. Remember, you're not alone in this journey. I'll see you in the next one.